Yes. Good afternoon, everyone. My name is Dr. Mrinal Gautam, and I am a psychiatrist. Currently, I'm practicing in Kolhapur. Okay. So this is my basic introduction. So today I'll be taking class on the topic advanced psychotherapy techniques. So as we all know that psychiatry is unique as compared to other branches, as compared to other branches of medicine. And in most of the branches, treatment we usually see mainly pharmacological or surgical. But in psychiatry, we deal with thoughts, emotions, behaviors, and that is where psychotherapy becomes a very extremely important part of any psychiatric management, any psychiatry related patient, or the holistic approach of the patient. Okay. So as we all know, I'll be showing you the slides, but next comes your interactional model. So the thoughts, emotions, and behaviors, they are all interconnected. You can see the arrows are both sided. So they are all interconnected. So on expanding the loop, first comes the thought, then comes after thought comes emotion, then after emotion comes the behavior, then after behavior comes the thought. For example, one example is given on the screen, that if you change the thought I failed to I can learn, you can change the emotion from sad to hopeful, which changes the behavior from withdrawal to study. So this is the basic. This two line is basically the improved thing what we are learning. So one example I will say, like for example, I'm saying I am used.
Today's mental health challenges need more than basic counseling. Advanced psychotherapy techniques help doctors manage anxiety, trauma, depression, and behavioral disorders more effectively. With evidence-based approaches like CBT, DBT, and mindfulness therapy, patient outcomes improve significantly. Specialized training helps healthcare professionals build practical therapeutic and communication skills. Stay updated with modern psychotherapy methods and deliver better patient-centered care. Start mastering advanced psychotherapy techniques and take your mental health care expertise to the next level.
Yeah, so next comes your questions, which we call as mind traps. So why does they occur? How does brain simplifies information? So in this, there is collaborative, non-judgmental explain technique, which is done. I'll be doing Socratic questioning evidence test, which is done here. So I'll be explaining about Socratic questioning in the further slides. But what do you understand by cognitive distortions? So in this, if any vulnerable situation comes in front of the patient, comes in front of the person first magnifies it. Magnification is there. So magnification means what? Making mountains out of molehills. मतलब तिल का ताड़ बनाना, जिसको हम कहते हैं, हम जो मुहावरा यूज करते हैं, तिल का ताड़ बनाना. प्रॉब्लम बहुत छोटी सी होगी, लेकिन because of the cognitive distortion, the person makes it very big. Okay. So this is various, just few examples of case study I'm telling you. First is the patient. Patient comes to a doctor and he asks that I am a total failure and I failed in one subject module. Now I will never be a psychiatrist. So doctor says it sounds like you are feeling quite discouraged. When you say you are a total failure, are you basing that entirely on this one exam? The patient said, yes, if I was good, I wouldn't have failed. So by this, the script of role play, you can understand the level of cognitive distortion which the patient is having just by failing an exam. And it is very normal. Anyone can have such thoughts. You and me, anyone who have ever failed an exam, who have ever failed in the past, might be having.
Sometimes the mind tricks us into believing negative thoughts that aren't completely true. These unhealthy thinking patterns are called cognitive distortions. In advanced psychotherapy, therapists help patients identify and challenge these distorted thoughts, like overgeneralizing, expecting the worst, or thinking in extremes. Therapy teaches healthier ways to think, react, and manage emotions, because changing thought patterns can truly change lives.